Good morning, everyone. First of all, thanks to the organizing team, Dr. Vijay Bada sir, for this opportunity. Today, my topic is about the surgical management of early gastric cancer. As defined by the previous speakers, early gastric cancer is defined as a gastric cancer which is localized only to the mucosa and submucosa, and regardless of the lymph node metastasis. So it is just T1, which can be further subdivided into T1A mucosa and T1B up to the submucosa. So why early gastric cancer is very important? Because apart from the routine gastric cancers which we see routinely, early gastric cancer has an excellent prognosis, that is more than 90% overall and 5-year overall survival rate. But detecting these lesions are very important because generally we see very advanced tumors. Early gastric cancer can only be seen where there are intense screening programs or high risk screening endoscopies. So the most important factor which defines the treatment as well as the management in early gastric cancers is early detection as well as the nodal metastasis. If the nodes are positive, the complete treatment plan and the management will change. So I'll just quickly run through the basic slides. Overall incidence of early gastric cancers is now slightly increasing because of the screening programs. It is still around 50% in the eastern side, that is Japan and South Korea, where they have very stringent screening programs, and up to 20 to 30% in the western side. We are still lagging behind in these senses. So diagnosis is mainly by endoscopy, and the latest advances in the endoscopy by chromo or narrowband imaging we have seen in the previous slides. So any abnormal raised fold or any abnormal lesion which can be further classified on narrowband or chromoendoscopy had to be biopsied according to the protocols. So this is the Paris classification of the endoscopic appearance. And the role of EUS. EUS plays a very important role in the management of patients with early gastric cancer. First thing, the most important thing is the level of the tumor invasion, that is whether it is restricted to T1 or T2, whether it is extending beyond the submucosa or not. Next most important thing is the lymph nodal status. Any abnormally appearing lymph nodes in EUS have to be biopsied. So the advantage of EUS is any abnormal lymph node, you can just take an FNAC through it, and that will decide the further treatment plan in this. If the lymph nodes are negative, then we can go for a in the treatment protocol for early gastric cancer. If the lymph nodes are positive, we have to go for a standard D2 lymphadenectomy. So what are the management options for early gastric cancer? There are two most important management options, that is endoscopic and surgical. Endoscopic, as Santa sir has just now shown us ESD and EMR and the other latest procedures. The other thing is the surgical management. So the indications for endoscopic treatment. So when is the surgery indicated in early gastric cancer? So what all the lesions of early gastric cancer which are not amenable for endoscopic treatment, that is poorly differentiated histology, size more than 2 centimeters, ulcerated tumors or suspected lymphovascular invasion or diffuse type of tumors. These are not amenable for endoscopic resection, or else the other way, all these are, if all these are not there, they are a perfect candidate for endoscopic resection. And any suspicious nodal meds, patient is not a candidate for endoscopic resection. And any non-curative endoscopic resection, and most important of these are the positive margins as well as a piecemeal resection. So these two characteristic features in endoscopic resection defines the further treatment plan. And any local recurrences or metachronous tumors, any local recurrence at the site of the ESD where it has already got fibrosed and other things, it is technically challenging for endoscopic resection. Or any metachronous tumors, it means it is like a field cancerization. So all these candidates are perfect candidates for surgery of early gastric cancer.